Concept Application Project Healthcare Delivery by Cynthia Adaba. Systems in healthcare are open systems that interact with the internal and external forces. Systems have four major elements: the structure, technology, people, and environment. We will be looking at the patient care delivery module, which examines the interrelationship between module components, insight towards organizational practices, understanding work environments, and identification of outcome predictors. According to O'Brien et al., patient care delivery module illustrates three major components, such as the inputs, the throughputs, and the outputs. We will be examining the microsystem, which is a small group of people who work together on a regular basis to provide care to a discrete subpopulation of patients. It is a local milieu in which patient providers, support staff information, and processes converge for the purpose of providing care to meet healthcare needs. We will now look at the role of the leader in a microsystem module. The leader balances the setting in reaching collective goals with empowering individuals' autonomy and accountability. How does the leadership in a microsystem influence the care? A strong leadership is of importance when developing effective teams for improving the quality of care for the patients. The leader will encourage the heart, allowing for the staff to provide care that is compassionate. A leader will model the way. Model the way simply means that they will walk the walk and not just talk the talk. They will lead by example, inspire shared vision, enable others to act, which also gives the staff a sense of autonomy and accountability. Challenge the process. They will act as advocates for the patient's rights. We will now look at the organizational culture and support in the microsystem module. The larger organization looks for ways to support the work of the microsystem and coordinate handoffs between the microsystems. How does the organizational support for the microsystem impact the delivery of care? By supporting the system which facilitates the transition between systems. The organizational support provides microsystems with resources for quality care. Organizational support provides additional staff in the delivery of care, allowing for quality care. What impact does culture of the microsystem have on the delivery of care? The safety culture of the organization is the product of the individual and group values, attitudes, perception, competencies, and patterns of behavior that determine the commitment to and the style of proficiency of an organizational health and safety management. The microsystem module: patient focus and staff focus. The care in the microsystem should be patient-centered. However, some microsystems are extremely staff-driven, and this leads to poor outcomes. The patient focus allows for smooth patient care flow. Staff focus is also patient-driven because the staff is equipped with ways and tools to improve quality care delivered, such as the following: in-services, training and retraining, education, and of course, expectations. Interdependence of care team allows for the multidisciplinary care team in provision of care, and every staff person is respected for the vital role he or she plays in achieving this mission. How does the interdependence of the care team lead to patient-centered care? It allows for comprehensive care plans. It also allows for care plans to be individualized and allows for the disciplines involved to communicate patient's care, which leads to quality and patient-centered care. How is the information and healthcare technology used in a microsystem module? Information environment has been designed to support the work of the clinical staff to patients and staff to staff. It allows for real-time information to be shared, leading to updated information in the provision of care delivered. The healthcare delivers the electronic healthcare records does have its fair share of benefits if the end user has received extensive training. One of the critical components of healthcare information technology, as stated by Middleton et al., is usability. We will now look at the process of healthcare delivery improvement activities. Process improvement activities are essential parts of daily work in order to improve quality of care. Quality assurance or quality improvement committee where members meet to study and measure care given, identifying ways to improve on care provided. Identify patient safety priorities based on assessment of key safety measures. Address the work that will be required at the microsystem level. Establish patient safety demonstration sites. Even a good example of this will be simulation classes where a simulation is put up where staff is involved and they can see a simulated scenario of patient safety. Performance patterns that are used in a microsystem should be routinely measured for continuous quality of improvement in a microsystem. Safety measures must be developed and data fed back into the microsystem in order for changes to be made based on the data. The specific aspect of this system which needs improvement is culture. While culture is not a new concept, it is a difficult concept to manage and understand, especially by leaders. The rationale behind this much needed improvement is that microsystems need to move away from culture that recognizes individual failures and move into recognition of system failures because if a system fails, there is a chance that it will fail another individual. So care must be taken in improvement of systems in order to improve quality of care provided. Time should be dedicated into bringing awareness to the fact that the care must be patient-centered in order to improve quality of care. Firstly, I suggest that medical, nursing, and auxiliary academicians incorporate safety cultures principles into educational curriculums. The staff must undergo training on safety culture and awareness. Improvement Quality improvement measures must include staff members. Encourage team building among the clinical staff by recognition of excellence among peers. Healthcare delivery system must involve the patient and family, allowing for a more patient-centered care. A culture of learning exists within a hospital when the organizational culture seeks to learn from mistakes and integrates performance improvement processes into the care delivery system. Overall, we as clinicians must find ways to improve quality care. We must move into patient centered care, and in order to do that, in a microsystem level, we must start aspiring to include the patients and also respecting their rights. Thank you.